This is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series seeking to inspire hope and promote wellness by applying evidence-based psychology to the COVID-19 situation. I'm hoping to somehow help us make it through this crisis with grace and humanity. This one is called Substance Use in the Time of COVID-19. Ever feel like a rat in a cage? Dr. Nora Volkov, who's the director of NIH's National Institute on Drug Abuse, or NIDA, has recently written in the Annals of Internal Medicine how the global COVID-19 pandemic is colliding with another public health crisis, that of substance use disorders. By that, she meant that we were already struggling with the wildfire opioid epidemic and the fatalities related to that, and then the COVID-19 tsunami hit us. As Dr. Volkov points out, we can easily see how COVID-19 can make things even more difficult for people with addictions. For example, the healthcare system may not be prepared to take care of them in the midst of demands created by COVID. There are also stigma and social issues created by this crisis. So-called social distancing may make these people even more vulnerable because it interferes with many of the support systems that can help them to reach and maintain recovery. Add to that the fact that drugs themselves negatively impact our physiology and make us more susceptible to infection and more prone to poor outcomes, and it becomes very obvious why we should be concerned about the collision of these public health crises. Okay, so now we're going to hear about the intersection of COVID-19 and substance use issues from a Missouri expert. I am blessed to know and work with some amazing people who are deep reservoirs of knowledge and wisdom, and more importantly, compassion. I'm pleased and privileged to have Libby Brockman-Knight on this episode. Libby has forgotten more than I'll ever know about substance use treatment, and Compass is fortunate to have her as Deputy Chief Clinical Officer of SUD Services. I was able to conduct a virtual Q&A with her, safely ensconced in our respective homes. Libby, thank you very much for agreeing to answer a couple of important questions about substance use in the time of COVID. We really appreciate it. So my first question is, from your perspective, what are some important things for us to know about the impact of this situation on substance use?
Unfortunately, we know from history that during times of stress and national emergencies, there is a rise in the use of alcohol and other substances. We know by looking through history that following Hurricane Katrina, 9/11, and other pandemics, there was also a rise in the use of substances and those with alcohol use disorders for almost up to 2 years following the crisis. We also know that one recent study indicates that there was almost a 300% increase in alcohol sales in March of this year from January of this year. Social isolation, economic uncertainty, and other stressors may lead people to self-medicate with alcohol and other substances. However, the increased use of alcohol can also lead to an increase in other problems such as domestic violence, increased depression, or even weakening the immune system.
Okay, so we know that we're likely seeing increased rates of self-medication, increased substance use generally in response to the stress and uncertainty of the current era, and that it may go on for some time even after the crisis resolves, which of course makes what you do, what Compass and our sister agencies do in treatment all the more important in coming months and years. And speaking of treatment, we know from the research that it works. And we know how important treatment is for people with addictions, how it helps keep them from slipping backwards, especially during times of stress. So can you give us your take on how COVID has and how it will impact substance use treatment delivery?
Traditional treatment methods for substance use disorders have largely centered on providing frequent support and structure through groups, counseling, and community support services. For people who rely on treatment services, COVID has brought particular challenges and risks, especially due to social distancing. Many needed services for those consumers, like residential treatment, detox services, and support groups, have become more difficult to access due to temporary closures. However, treatment providers have worked quickly to adapt to the changing demands of COVID and to make sure that those with substance use disorders still have access to treatment and support, even if it is at a distance. This has resulted in some positive changes in how we treat and work with individuals with substance use disorders. For example, the DEA and the Substance Abuse and Mental Health Administration eased certain restrictions to allow first-time meetings for those with opioid use disorders needing medication-assisted treatment to be done virtually rather than in person, and make it possible to write longer prescriptions for those patients. As a result, Compass Health has been able to offer virtual Suboxone clinics to those individuals unable to come into our clinics, essentially going into the home of a consumer who might be experiencing withdrawals in order to prescribe them needed medications.
Thanks, Libby. I know things are really happening quickly, and organizations and folks are adapting very quickly. Certainly know that our organization, Compass Health Network, has turned the battleship in a lot of ways in a very short amount of time. But I'm wondering if you could say more about what Compass Health Network is doing to innovate and adapt and meet the needs of clients during this fairly unprecedented time.
In reaction to the coronavirus, substance use assessment, individual counseling, psychiatry services, along with support groups and other resources, have really moved online. Through platforms like WhatsApp, Zooms, and Teams, we've been able to continue to provide needed support and check-ins for clients during this stressful time. These platforms have also helped clients overcome barriers to traditional treatment, like lack of transportation or difficulty in making initial contact, as virtual platforms can seem less threatening. Compass Health has also tried to bridge the gap for those without smartphones by providing services via telephone and utilizing grants and other programs to get clients needed technology or access to Wi-Fi. Compass Health also quickly implemented online group services, for example, our Choices program, which is free for those struggling with substance use. We have also implemented a crisis line for those struggling with substance use, depression, anxiety, and other issues related to the pandemic. I believe while there continues to be some limitations to access for some needed services like residential and detox, that COVID has really brought about some ingenuity and new ways to reach out and engage those struggling with addictions.
For sure, COVID is impacting everything in life, and treatment is no exception. It's amazing to me to see how our agency has retooled and regrouped and adapted and is finding new ways forward. We'll come back for a final question of Libby to close the episode. As I've noted before, the lack of a sense of mission, the lack of purpose in life, has been identified as one of the major factors that can make people more vulnerable to taking drugs. We know that feeling irrelevant, feeling that no one cares about you, is probably one of the most devastating feelings a person can have. Epidemiological studies show that social isolation and neglect, loneliness, etc., increase dramatically the risk of taking drugs. And if you're trying to stop taking drugs, it increases that risk of relapse that we're worried about. So as Dr. Volkov has put it, the challenge is, how do we provide social support for people at risk of substance abuse during the COVID-19 pandemic? This got me thinking about what we've learned about substance use in the past few decades. Some of you may remember a series of anti-drug messages from the 1980s, including one PSA, based on studies from the 1960s, showing rats in a cage dying from heroin consumption. You see, in those studies, scientists put rats in cages with 2 water bottles. One bottle had water, the other bottle had water laced with either cocaine or heroin. In virtually every case in this free choice situation, rats would keep going back to the drug-laced water bottle and fairly quickly die of an overdose. The conclusions are clear, right? Drugs have an inherent chemical hook in them. They are addictive, and if you start them, they will kill you. Well, kind of ironically, those messages and the underlying studies became an inspiration for a psychology researcher named Dr. Bruce Alexander at Simon Fraser University. This clever psychologist wondered, what else is going on here? And maybe it's not really the drugs themselves that explain what's happening. He wondered if it might be the cage, the environment in which these rats were placed. For sure, a bleak and solitary existence in which they only had one thing to do: drink water, take drugs. Well, I guess that's 2 things, but you know what I mean. So Alexander repeated the experiments, but rather than putting one rat in a small cage, he created what he called Rat Park. Famously now, this cage was filled with lots of good things to eat, other rats for socialization, and plenty of physical intimacy, and toys and colored balls and that sort of thing for recreation. Rat Park also had 2 water bottles, as the original studies had, one with water, one with drugged water. The rats tried both, but given the choice between good food, enjoyable activities, playful friends, none of the rats became addicted or overdosed, not a single one. In fact, they didn't even like the drugged water. Does this study have any relevance to humans? Of course it does. Pesky research ethics prevent us from putting humans in cages for extended periods of time with ad libitum drug consumption. But, as Johann Hari describes beautifully in his book Chasing the Scream, in the Vietnam War and its aftermath, we have something of a natural human experiment that illustrates the principles very well. At one point, a huge number, upwards of 10% of American soldiers stationed in a miserable jungle, where they didn't want to be and where they might be killed at any moment, were using heroin. It was feared that when these soldiers came home, we would have hordes of vacant-eyed heroin addicts roaming our streets. But that's not what happened, thankfully. When they were removed from their virtual rat cages in the jungles of Vietnam and were able to come home to the embrace of family, the meaningful activities of employment and school, and so forth, most were no longer interested in heroin and simply quit. They were not criminal nor physically addicted. They had just changed their cages. As the great Hungarian-born Canadian physician Dr. Gabor Mate has put it, all substances of abuse will either treat pain or distract from pain. So the question is not why the addiction, but why the pain? This question is a haunting one. It is what we have to answer if we're to make long-term sustainable recovery possible for people with addictions. The sources of the pain that humans treat with whiskey and OxyContin, with cocaine and benzodiazepines, are many. Chronic physical pain from injuries and illnesses for sure, but I'm convinced it's much more likely to include psychic pain from trauma, either in childhood or later, from interpersonal alienation from primary or important relationships, from family disconnection and conflict, from shame and guilt heaped upon us, from abject loneliness, from having not found a guiding passion or meaningful purpose for your life. These are the real sources of pain that lead so many to find connection with alcohol or other drugs. These are the sources of pain that lead to self-medication. These are the sources of pain we can and must find ways and means of treating. I'll conclude with an all-too-obvious application of all of this to our current circumstances, the COVID-19 crisis. Under quarantine or isolation or, again, whatever we call this thing, we may all begin to feel like rats in cages, right? What if our cage is feeling pretty desolate and we have 2 bottles from which to choose? We might begin to choose the whiskey bottle or the bottle of pills, rather than the healthier water bottle, if we don't take care to enrich our environment. Remember, Rat Park was an enriched environment that included, not insignificantly, other rats with whom to play, socialize with, have intimacy with, be close to. So we need to make sure we enrich our environments by bringing our offline supports online through regular phone calls, FaceTime, Zoom, syncing up Netflix accounts, or whatever we can do to stay close. Getting and or staying connected with others is really the most important thing we can do for ourselves and others right now. We need to enrich our environments by refusing to drink from the fire hose and restricting the flow of bad information and news. Make sure we're getting good information. Balance it with stories of human kindness and resilience, of hope and inspiration. We need to enrich our environments by developing and demonstrating mastery. Learn something new, practice something old. Be most helpful and hopeful. Make sure it's something that provides meaning and purpose to your life. Some way of adding beauty to your own life or to those of others. Some way of contributing joy to someone who may desperately need your light. Let's all enrich these cages we're living in together. So, Libby, a final question. We can extrapolate from the Rat Park studies that when we're in confined spaces with not much to do, feeling isolated, etc., we may be more likely to turn to alcohol or other drugs to self-medicate the anxiety and even social pain we might feel. What recommendations do you have for those worried about turning to substance use during this time of social isolation and lockdown?
So for those who may have been binge drinking or drinking more often than normal due to stress, I would encourage them to reach out for support to find healthy ways to cope with the stress. Eat well, take up painting, exercise, call a friend, attend a meeting virtually, but most importantly, ask people for needed support or help as we're all struggling to cope with COVID, and we are all in this together.
Thanks again, Libby, for sharing your wisdom and experience with us. As you said, we are all in this together, and that's exactly how we will get through it together.